What is up, you guys? My name is Austin Marks and welcome back to my YouTube channel. So I'm currently a respiratory therapist, and on my YouTube channel I talk about respiratory therapy as well as different things about PA school. So if you want to see more of that, make sure you like and subscribe. So in today's video, I'm going to be talking about the Aprt, or the Advanced Practice Respiratory Therapist. So this is when a respiratory therapist completes some kind of higher education so they can go ahead and become licensed and practice as an advanced practitioner. So if you don't know what an advanced practitioner is, a few examples are a PA, or physician assistant, an NP, a nurse practitioner, or a nurse anesthetist, which is a CRNA. So in 2015, the AARC as well as the MBRC started talking about coming out with something such as the Aprt. So the reason they started talking about this was because around 2030 there's suspected to be a shortage of cardiologists as well as pulmonologists, and if you look at the top 5 leading causes of death, 3 of 5 of them are related to cardiopulmonary. However, a few other societies that are endorsing this are COARC, the American Thoracic Society, and the American Society of Anesthesiologists. So as I said, they started this program in 2019, even though they started talking about it in 2015. There's only one program in the United States that offers this, and that is Ohio State. So I'm going to go over how to apply, what you're going to learn in the schooling, how it correlates with PA school when applying, because I know the whole PA school route and what exactly is required for that. I'm also going to talk about where an Aprt could potentially work, what's our focus of care, what autonomy do we have, can we go ahead and can we order tests. I'm going to talk about all of that, so stay tuned. So the program at Ohio State is a graduate level program, so you can already get your master's in respiratory therapy. However, there is a difference between getting your master's and getting your master's for the Aprt. So the master's goes ahead and it's a broad spectrum of the respiratory, such as what it's like in the NICU world as well as the adult world. It goes over a little bit more drugs and everything. However, the Aprt program is a little longer and it goes a little bit more in depth with different things. That is because as an advanced practitioner, you have a very broad area to cover. You got to know a little bit about everything, not just the cardiopulmonary side. So just to enter the program, it's very similar to applying to a PA school. So to apply to a PA school, you need to complete a certain test, you need to write a personal statement, you need to get letters of recommendation from a physician, maybe a boss. So when you go ahead and you apply to the Aprt program, you have to have a transcript, so you have to graduate from a COARC accredited bachelor's degree program. You have to have a resume that includes evidence of at least 1 year of experience in any desired clinical specialty, such as adult critical care, pediatrics, neonatal, primary respiratory care, neuromuscular respiratory care, or any sleep disorders. So you also do have to write a personal statement, just like you do with a PA program. You also have to get references, so this has to be from a boss as well as a physician, just showing your expertise and that you have a desire to learn. And then you also have to get an MBRC verification letter. So this basically attests that an applicant is a registered respiratory therapist, that they're not just a nurse applying to a respiratory therapy program. So that's another great thing about the Aprt, is that only respiratory therapists can apply. So this goes along with nurse practitioner school, only nurses can apply to NP school. So me applying to PA school, anyone can apply to that. So I know people who applied to PA school with a bachelor's degree in theater. So they met all the requirements for the classes, they took the special test, they got a little bit of healthcare experience as a CNA or anything like that, and then they went ahead and applied. So for the Aprt, you have to be a respiratory therapist in order to apply to this program. I'm also hoping that more schools will go ahead and open up an Aprt program. So this is going to need teachers, so I don't know if this is going to be PAs that are going to be teaching it, if respiratory therapists are going to be teaching it, I have no idea, maybe even doctors. I definitely hope that other schools will go ahead and follow Ohio State, and that there will be more programs to just go ahead and get this career opened up. That way more respiratory therapists can continue their career and become an advanced practitioner. So once someone would actually graduate from the Aprt program, what kind of setting could they work in? They could potentially work in critical care, physician clinics, cardiopulmonary rehab centers, home care, maybe emergency department and urgent care, and then there are a couple other places that they could potentially work, but those would be the main ones. So mainly the hospital setting, as well as some outpatient clinics or even maybe nursing homes as well. So what does the spectrum of care or the scope of practice look like? So I'm going to go ahead and compare what the APRT can do to a PA, since I know about that a little bit more. So the APRT could do physical exams. They could order diagnostic tests such as a CT scan, an MRI, or an X-ray. Diagnosing. They could do counseling. They can do educating, and they could also manage different healthcare teams. So if you look at this scope of practice compared to a PA, PAs can also administer and provide medications to patients with prescriptions, just like an APRT, perform surgical procedures under local anesthesia without a personal presence of the supervising physician. So this is something that APRT could not do. They could not go into a surgery setting. They could order laboratory procedures just like an APRT, order different therapies and nursing services, take history and physical examination, make an assessment and diagnosis, and then initiate, review, and revise treatment plans just like the APRT can. So the main disadvantage is that a PA would be in a surgical realm. A PA also has a broader scope of practice, so they could practice over the whole body, while an APRT would be mainly focused on the cardiopulmonary system. However, everything in the body plays a role with the cardiopulmonary system. So what we will be allowed to do and what we won't be allowed to do is a little disclosed. We don't really know at this point, considering no one has been hired as an APRT because no one has graduated from one. So I could definitely see this kicking off within the next 10-15 years or so. I know it's a long time. We gotta wait till the first class graduates. We gotta see when one will get hired. So if you Google the salary of an APRT or an advanced practice respiratory therapist, the salary comes up as $110,000. So the fact that it's already recognized as a career choice is a pretty good idea. So PAs and NPs, they make around this much. So that's also showing that APRT would follow in the same realm as an advanced practitioner. So that's definitely great news. I think that over the next few years, we're definitely going to see where the APRT is headed, where they will work, how much scope of practice they'll have, the autonomy, what will we be able to do. I feel like this is a great opportunity for the respiratory therapy career path to go ahead and move forward. Let me know what you guys think. Leave it in the comments. Make sure you like and subscribe and follow me on Instagram. See you in the next one.